university basically is this. We do know very well that private universities do have the required facility when it comes to accommodation. So what the government could do is really simple. Basically, you bring students on board batch by batch, and they stay within the facility for 14 days in a carefully isolated rooms. Now, if the first batch, let's say the first batch can accommodate 100 in the university facility of accommodation, they can accommodate 100. If the 100 are all clean in 14 days, because incubation time is 14 days. So if they are clean, we could move them to a different halls of accommodation, bring the next batch for private university. Now, if that model works effectively, the next thing is that all lecturers that will be involved in lecturing must take the COVID-19 test. And that, again, we should make provision for that going forward. After that, if that model is successful at the private university level, then government-owned institution can take a clue, which is a little bit going to be difficult, you know, the way government-owned universities are. Then the next line of opening should be private university, secondary schools. I know of private secondary schools that are far, far better than most government university when it comes to accommodation. Now, those guys, again, we use the same pattern for private university to open them up. You quarantine them for 14 days. After that, if there's nothing, you say, oh, you guys can congregate into a particular halls of accommodation. Then thereafter, you bring in the next batch. Then you ensure that the teachers are also tested for COVID-19. Then once this class of individuals are there, it then boils down to the fact that we all need to take responsibility going forward once we are trying to use this model to open up tertiary and private secondary schools. Now for primary and nursery schools, for me, they should remain closed because these folks, they are potential vehicle for COVID-19 transmission. Again, remember that COVID-19 or coronaviruses are in love with people within the age of 65 upward. Basically, the life expectancy ratio in Nigeria is somewhere around 55. But if you look at the NCDC demographic data, we know that 25 to 34, 34 to 40 are more prone to the disease in the country. Now, going to banking, telecoms, and other corporately established companies, we could do a kind of rota of 2 weeks. What that means is that we've got people in the banking industry or in the banking branch. We could say 10 staff comes in 2 weeks back to back, non-stop. Now, once your 2 weeks elapse, you stay at home to see if there are any symptoms of COVID-19. Then the next batch who were reserved for 2 weeks come into the workplace to work. Now, basically, why you need to do this is that we're trying to limit the number of people that come out on daily basis to work. So we need to do a kind of shift staggered opening when it comes to established company that are able to regulate their staff effectively. This does not cover the little SMEs or one-man business that, you know, they run the way they like, but I'm talking about established companies. Now, folks within the age of